Thank you, Warren. And I want to add my welcome and also extenderles una muy cordial bienvenida in my other language. Imagine all your languages, and I would say hello in them, but I would rather spend a little more time talking about other things, although I should say sabah khair, shouldn't I? Okay. And just as a reminder, our focus for this workshop is taking healthcare providers out of the clinic into the community. And I think about that as I remember one of our former Surgeon Generals, Rich Carmona, talking about the fact that he went into the Southwest as a very, he says it himself, kind of arrogant doctor saying, I really know what I'm doing. And he was at a health clinic there, and he was waiting for people to come to him. And one of the first patients he had was a child with carbon monoxide poisoning. They got a helicopter, they got the child to Albuquerque, and the child didn't survive. The same thing happened a few weeks later. And he started thinking about what would happen if he kept sitting in the clinic waiting for these carbon monoxide poisoning cases to come to him. And he decided to go to the source of the problem, which turned out to be setting up a Saturday after Saturday clinic to fix the old trucks that kids were being left in on cold nights when their parents would run into the trading post just for a minute. And then they would be exposed to the carbon monoxide. So the solution to the clinical problem he saw was to go out with the community and fix the trucks. And I just want to keep that image in mind for this entire workshop. I was asked to give you a definition of culture. And this slide has essentially, there are 200 definitions of culture. I'm an anthropologist. We spent a lot of time on this. This slide combines the common elements of all of the definitions. And I think that there are two key points here. One is that it's constantly being modified through lived experiences. So that I greeted you in Spanish because I spent the first 12 until age 16 in Guatemala. And so that's in me, but so are all the years since then in all the countries I've worked in. And for everyone in this room, you have, your culture has been modified through your experiences. And then the other issue that in terms of bringing health to communities we face is that a lot of culture is at the unconscious level. So that the work of working with communities is respecting that and understanding that and knowing how to communicate. The next definition is community. At CDC, when we developed the community guide, I have control of this, don't I? Okay. We developed the community guide. We spent a year trying to define community, and we finally came up with this. It's basically, it's whatever you want. It could be, it can be geographic. But when I worked in South Central LA, there were people who said, well, I don't live here, but I come to church here, my family's here, and so on. It can be a community of people who are exposed to the same risks, whatever you'd like, and we can talk about that, but that sets the stage a little. Also wanted to establish for us an understanding of health disparities. And some people say measurable differences, and certainly, I would say preventable differences, and add that to this slide. This slide was developed out of our work at CDC. There was a group of people who wanted to just go disease by disease. And as you can imagine, there were a few of us who said, no, we have to take a look at the context of health. And I think the important point on this slide is that there is one item, and it's way down on the bottom here, health promotion, disease, injury prevention, and healthcare, that relates to clinical delivery of care. Everything else is out in the community. And the outcomes are influenced by what's out in the community. So that's, again, food for thought, setting the stage for our 2 days together. This is a quote from a book that was published in 1952, one of the anthropologists, Harvard School of Public Health, who started medical anthropology. And I came across it as I was thinking about this, and it says everything that we want to think about over the next 2 days. So our objective in this workshop is to think about, this is very simplified again from anthropology. Outsider is where we often come from. We come, and our one outsider perspective could be the Western biomedical perspective of the world. So a disease is caused by, and we have a whole list of things. And then you may get out into the community, and the community perspective may be entirely different. So that when we worked in Guatemala, one of the community perspectives was that ascaris, or worms in children, were caused by eating sweets, and all children had worms, so it was normal, and there was nothing you could do about it. Well, when you probe the insider perspective a little further, it turns out that the worms get agitated by thunder and lightning because you see more of them in the rainy season. Obvious reasons. I don't need to tell anybody in this room why you'd see more ascaris in the rainy season, and why you'd see more gastrointestinal problems in the rainy season in a Guatemalan village. And so the key to working with the community on eliminating ascaris was to say, come and get your children's worms removed before the rainy season and the thunder and lightning come. Because worms weren't a problem unless you saw them, and you really only saw them when kids had GI problems. So these are just two quick examples. I literally could give you hundreds, but what I want to leave you with is this concept that we have to always be aware that there is an outsider view and an insider view, and that our task is to understand both well enough so that we negotiate the best possible access to health. And when I say the best possible access to health, I go back to the previous slide. Nope. This one, which really is how we get to the best possible access to health. So with that, I think I'm delighted. I understand that many of us had trouble getting here today, and I'm actually delighted that our first speaker is now here. So I don't know, it's Jahan, but known as Gigi El-Bayoumi. And Dr. El-Bayoumi is an associate professor of medicine at George Washington University. And learning how to better educate and evaluate learners at all levels has been a long-standing interest of hers. And she served on the boards of the Center for Women's Policy Studies, National Women's Health Network, and Arts for the Aging. She's currently serving as a board member for Whitman Walker Health, and Dr. El-Bayoumi founded the Rodman Institute to honor her patient, Mrs. Dorothy E. Rodman. I have to add that, and actually this is true for somebody else in this room, Dr. Newton, that I know Dr. El-Bayoumi's mother, we're medical anthropologists together, we've worked in Egypt together. Dr. Newton's mother was a site visitor on my first NIH grant. So that may date me a little bit, but there are so many networks in this room, and here are just two examples. So I'm delighted to actually finally have a chance to meet you and to work with you as well. And you will be kicking off our conversation on responsibilities of and for the community. Oops,